Let's delve into the world of sciatica, a common ailment that plagues countless individuals. Sciatica refers to pain that radiates along the path of the sciatic nerve, which happens to be the longest and widest nerve in your entire body. To give you a visual, it's about the thickness of your thumb. This substantial nerve originates in your lower back, where 5 nerve roots converge to form the mighty sciatic nerve. These roots emerge from the lumbar and sacral regions of your spine, specifically from L4 to S3. When this nerve experiences irritation or compression, it leads to the often debilitating pain known as sciatica. Now, you've probably come across a plethora of stretches and exercises touted as remedies for sciatica, and while they can offer temporary relief, the frustration often lies in the pain's tendency to return. So let's explore how we can tackle the root cause of sciatica, not just mask the symptoms. We'll focus on natural approaches, although those stretches can still be beneficial as part of a comprehensive strategy. But first, let's understand what sciatica really is. In about 90% of cases, it stems from a disc problem. Think of discs as the shock absorbers between the vertebrae in your spine. They have a tough, fibrous outer layer called the annulus fibrosus, and a soft, gel-like center known as the nucleus pulposus. You can picture it like a jelly donut. When the outer layer weakens due to factors like age, injury, or poor posture, the inner jelly can bulge out or even herniate, putting pressure on those sensitive nerve roots that form the sciatic nerve. This can lead to a variety of symptoms, including pain in your buttock, which often shoots down the back of your leg, sometimes all the way to your foot, or even along the outer side of your leg. The pain isn't always the same. It can be sharp and stabbing, or it might manifest as a burning, gnawing, or numbing sensation. Sometimes there's even muscle weakness, as the sciatic nerve also controls muscles in your legs and feet. Now, there's a fascinating condition related to sciatica that you might not be familiar with: myeloneuropathy. The term might sound intimidating, but it's actually quite descriptive. Myelo refers to the spinal cord, the central highway of your nervous system, and neuropathy signifies nerve damage. So, myeloneuropathy essentially means there's a combined issue affecting both the spinal cord itself and the peripheral nerves that branch out from it. This can lead to a wide array of nerve-related problems, including those sensory disturbances we mentioned earlier, like burning, gnawing, numbness, intense pain, and even muscle weakness. What makes myeloneuropathy particularly interesting is its frequent association with nutritional deficiencies, specifically copper deficiency. While vitamin E and folate deficiencies can also contribute, copper deficiency is the most common underlying factor. This connection between copper and nerve health sparked my curiosity and led me to investigate the relationship between copper and sciatica. First, there's a whole world of therapies that utilize copper to combat inflammation and pain. Think copper bracelets, those trendy accessories that have been around for centuries, copper patches, copper-infused creams, and even supportive braces designed for the hip area that are lined with copper. These braces wrap around the buttocks and upper thigh, right where the sciatic nerve originates, providing targeted support and potential pain relief. Countless individuals report experiencing significant relief from these copper-based therapies. While the exact mechanisms aren't fully elucidated, there are a few theories. One is that copper's exceptional conductivity might influence the electrical fields in the body, which can become disrupted in areas of pain and inflammation. Another theory is that copper ions might have a direct anti-inflammatory effect. Although research in this area is still somewhat limited, the anecdotal evidence and historical use of copper for pain relief are compelling. Even ancient Egyptians recognized the therapeutic potential of copper, incorporating it into bracelets, jewelry, and other remedies for pain, inflammation, and arthritis. Interestingly, the Arthritis Foundation, a well-known organization, dismisses the use of copper bracelets and magnetic bracelets for pain relief. They claim there's no scientific evidence to support their effectiveness. However, as we often see in the world of natural health, sometimes what's dismissed by mainstream organizations can be surprisingly effective. This external application of copper is certainly intriguing, but what about the internal copper deficiency we discussed earlier? Well, it turns out that copper plays a crucial role in numerous bodily processes, including the formation of collagen and connective tissue. And guess what? The outer layer of your spinal discs is composed primarily of collagen, about 75%. So it stands to reason that a copper deficiency could lead to weaker, less resilient discs, making them more susceptible to damage and herniation, which, as we know, is a major contributor to sciatica. But copper's importance doesn't stop there. It's also a vital component of enzymes involved in nerve function, nerve signal transmission, and the maintenance of the myelin sheath that protects those delicate nerves. So, it's not surprising that a copper deficiency could contribute to sciatic nerve problems. Copper is truly a multitasking mineral. It's essential for collagen production, working in conjunction with vitamin C, which we often hear about in relation to skin health. But copper is actually a part of the vitamin C complex found in nature. It's also crucial for the nervous system, energy production, healthy sleep patterns, melanin production, which helps prevent gray hair, red blood cell formation, bone formation, and it even acts as an antioxidant, protecting your cells from damage. So how does one become copper deficient? There's a surprising number of ways. One is simply not consuming enough copper-rich foods. These include shellfish, especially oysters, organ meats like liver, which is a nutritional powerhouse, and even dark chocolate. Opt for the sugar-free kind, of course. Athletes are often at risk of copper deficiency because intense physical activity increases the demand for copper. This is especially true for those training at higher altitudes, which puts additional stress on red blood cells, which rely on copper for proper function. Taking excessive amounts of zinc or iron without balancing it with copper can also create a deficiency. These minerals compete for absorption, so an imbalance can tip the scales. Other factors that can contribute to copper deficiency include consuming refined flour products, like white bread and pasta, fluoride in tap water, which can bind to copper and make it less available. Excessive vitamin C intake, especially in the form of ascorbic acid supplements. Excessive sweating, copper is lost in sweat. Frequent sun tanning, due to copper's role in melanin production. Chronic stress, which depletes many nutrients. High levels of DHEA or cortisol, stress hormones. An imbalance of potassium, which can worsen copper deficiency. Drinking distilled water, which lacks minerals. High niacin intake, gastric bypass surgery, which can affect nutrient absorption. Excessive sugar consumption, coffee and alcohol consumption, and even artificial sweeteners like aspartame. There's also a genetic component to consider. Some individuals have a genetic predisposition to copper deficiency due to variations in the genes responsible for copper absorption and utilization. These variations, known as polymorphisms, can make it harder for the body to absorb and utilize copper effectively, even if dietary intake is adequate. This can lead to a range of health issues, including sciatica, carpal tunnel syndrome, and even an increased risk of compression fractures, as copper is essential for bone health. So, what can you do if you suspect a copper deficiency might be contributing to your sciatica? One option is to try those external copper therapies we discussed earlier, like a copper brace, patch, or cream. These can provide temporary relief while you address the underlying deficiency. But it's crucial to tackle the deficiency internally as well. Make sure you're incorporating copper-rich foods into your diet. If you choose to use a copper supplement, start with a conservative dose around 2 milligrams per day and gradually increase it over a month to about 20 milligrams. This gradual approach allows your body to adjust and helps you determine the optimal dosage for your individual needs. After a month, you can experiment with lowering the dose and see how you feel. If your symptoms return, increase the dose again. Over time, you might be able to taper down to a lower maintenance dose. This focus on the connection between copper and sciatica is crucial, but it doesn't mean you should disregard other aspects of sciatica management. Those stretches and exercises you found online, they can still be beneficial for improving flexibility, strengthening muscles, and promoting blood flow to the affected area. Remember, a holistic approach, addressing both the internal and external factors, is often the most effective way to find lasting relief from sciatica.